So for the Turner syndrome, we now turn to um, gonadal dysgenesis. So, a while ago, Klinefelter syndrome is actually a testicular dysgenesis, but this one, Turner syndrome, is actually a gonadal dysgenesis. It results from a complete or partial monosomy of the X chromosome. It is actually characterized by hypogonadism in phenotypic females. It's actually the most common cause of hypogonadism in phenotypic females. Um, the second X is actually necessary for oogenesis and ovary development. However, for the case of Turner syndrome, like for example, we have different types. Like for example, this one, 45XO. This will present with no bar body. As what I've been discussing a while ago for the other types of genetic disorders. A bar body is present when there are two or more than two or more than X chromosomes. Since um, those extra chromosome will be inactive or will present as the bar body. Actually, the bar body is an inactive X chromosome. So, since there will be no inactive X chromosome, since there is no extra one, it will present with no bar body. So, since there is no second X, which is actually necessary for oogenesis and ovary development, the patient will present with, usually, with here primary amenorrhea. Primary amenorrhea is due to gonadal dysgenesis, and there is atrophic or streaked ovaries. So, but before we discuss the clinical features, we'll just go to the types first. For types, we have the 45XO karyotype, which is actually 57% of the types. There's high postnatal mortality, which is actually a classical Turner syndrome. And usually they live until adulthood. It's actually a consequence of meiotic non-disjunction. Meiotic non-disjunction. Just like in the case of Klinefelters, both are meiotic non-disjunction types of um, disorders. For the second one, you have the defective second X chromosome, which presents with these kinds of karyotype. So for this one, 45XIX, the long arm of, this is actually a deletion of the small arm. It's actually a deletion of the small arm, and there's a formation of an isochromosome of the long arm, meaning the long arm is duplicated. For this one, 46XR X is actually deletion of portions of both long and short arms. So, uh, forming a ring chromosome formation. The R represents the ring chromosome formation. In this one, this two is actually deletion of portions of the short. This is a short. This is short since it's P, and this is the deletion of a portion of the long arm. For the mosaicism, there are two or more cell lines, one of which is 45XO, and they don't completely express classical phenotype because they have wide range of clinical severities. There are many types like 45X, 46XX, 45, whatever. But the most important of which is the 45X, 46XY mosaicism. It's actually the mosaic which presents a risk of gonadoblastoma. So this will be highlighted. The clinical features, so a patient will come to your clinic with short stature, with primary amenorrhea. So she's, for example, she's already 17 years old, so she still does not have her menstrual cycle. And then usually with this one, since there is no menstrual cycle, as we all know, the atrophic streaked ovaries will actually lead to, can you guess? Infertility. And then there's also webbing of the neck. I'll show you a picture. This is actually a picture of a person with a Turner syndrome. I just googled it. Turner syndrome. So webbing of the neck. It's actually lymphedema. You can see here. There's actually a lymphedema of the foot. It's usually because of abnormal lymphatics, and can be cause of cystic hygroma. patient can also present with hypothyroidism, hydrops fetalis, and for some parts, like this one, poor breast development can present with a broad chest and wide spaced nipples. And it's not shown here, but some of them may present low post hairline. And then can have pigmented nevi. Here, pigmented nevi. These are brown spots or nevi. And then the most important one would be the coarctation or constriction of aorta. A percentage of patients with Turner's have cardiac problem, which are much less severe compared to patients with trisomy 21, 18, or 13, but this is actually the most associated cardiac abnormality with patient with Turner syndrome.